Hello, good morning. This is Dr. Parwani. I'm a pathologist at the Ohio State University. I want to thank the ESTIP to invite me today in this town square meeting on the use of clinically validated AI tools for pathology. I think this is an exciting time to be a pathologist. There are a lot of tools and opportunities available for pathologists. So today I'd like to share with you my experience. So we have rapid innovations in pathology today. We have more variety and complexities of available tests than ever before and services. We have new molecular testing, we have advanced equipment and testing technologies, more automation, and we have digital and computational pathology, which contributes to use of AI tools. So today, if you look at pathology and where pathology is going, we have basically have an ability now to take a glass slide and take the microscope, which is used to review the glass slide, put it inside a box, and create a digital image, a high resolution digital image which consists of millions of pixels, and be able to computationally interrogate those different pixels to look for features, to look for clues about the patient's diagnoses. So healthcare is evolving rapidly. We have digitization of healthcare. Patients are more involved. They want to know, what kind of cancer do I have? What kind of disease do I have? Why is it taking so long to get the results? And as a physician, as a pathologist, we have a lot of information overload. Things that I used to know in medical school and residency are no longer enough. We know more about kidney cancers than ever before. We know more entities. We know more about genetics, mutations. And as a result, a lot of this information is being used in arriving in clinical diagnostics. So AI is already has made a major impact in all walks of life. So why not pathology, right? So why not use AI for pathology, for things that are quantitative, for things that are objective, and use AI to help us with those objective things. So if you think about the whole slide images, we have the pixel pipeline, we have artificial intelligence and deep learning, whole genome sequencing, exome sequencing. We can create a genomic pipeline. We have liquid biopsies. All these tools combined with artificial intelligence has an ability to transform the field of pathology, to improve patient care, to make pathologists who are already overloaded with work make their life easier in terms of doing more work efficiently, and coming to clinical diagnosis, which is takes not just counting things, but actually put things together. That's the reason why we went to medical school for pathology. So if you think about artificial intelligence, there are different arms of artificial intelligence. You have machine learning, natural language processing, speech processing, expert systems, planning, optimization, robotics, vision. Many of these things have already been used in pathology. We are now starting to use natural language processing. We've been using machine learning for many years in pathology, for example, in cytology. We've been starting to use speech more and more in pathology, when you dictate in the gross room, you can use natural language processing and speech recognition. And the vision, the image recognition, the machine vision, all these are things where pathology is touching on. Many of these things have been used in the research setting, maybe not in the clinical setting. So pathology is ready for a disruption, potentially to enhance the use of augmented and intelligent pathology, which is aided by AI and deep learning. So if you're a pathologist and you're watching the clock, you have a stack of cases. When these cases are digitized, the computer can process it and present the image to you. But there are other pathways. The computer can also find features, quantitate things for you. As a pathologist, this is exciting. This is exciting because I now have more time to do other things. I have more time to focus on patient care. So this technology, AI, can satisfy an unmet need, which is to educate clinicians about the concepts such as selecting the right test for the right patient at the right time. If you think about what are the tools out there, right? So 5 years ago, 10 years ago, we had several labs who were just exploring digital pathology. Today, we have many labs who have now digitized their workflow. Today, we are witnessing the first commercially available tools for AI for pathologists enter the market. So, for example, Page AI recently got approval for a prostate cancer tool which can create the cancer, which can find cancer, which can detect cancer. So this is a really, really powerful tool. What about other aspects? So this is more of a research study using deep neural networks, where if you look at the left-hand side, the pathologist has annotated these cases of lung adenocarcinoma and has tried to subclassify them as lipidic, acinar, papillary, micropapillary, solid. On the right hand side, the computer AI tools have done the same thing. And you can see there's a remarkable similarity and significant overlap between manual pathologist annotation, which took several hours, to a deep learning annotation, which probably took a few minutes or even few seconds. So as soon as you think about these possibilities, you can see how this will change the pathologist's workflow. You can see how these things will help the pathologist do their work more accurately and improve their turnaround time. Patients are anxious. They want to know, what do I have? The better we are at utilizing AI and computational pathology and some of the newer tools, we can provide those answers faster to patients and more accurately. Obviously, you don't want to just provide fast answers, you want to provide accurate answers. So this is an exciting study. In this study, the authors, they looked at prostate biopsy. So in panel A, you can see unstained, deparaffinized, native non-stained image patches, which were generated, which were produced in the lab, but the slides were never stained. In panel B, they were stained with H&E. But look at panel C. In panel C, all these, if you look at these yellow arrows, these are benign glands. All of these were generated using an H&E stain, which was computer generated. So it's not, but if you compare B and C, I cannot tell the difference. I don't know if you can. But more remarkably, if you go to panel D, the computer has already outlined the areas in green, which are cancer. And they've gone directly from an unstained slide to a slide which has been stained artificially and has AI on top of it to allow to show what are the true positives, what are the false negatives, what are the false positives. So you can see it's remarkable that today we have this technology where you can go directly from an H&E unstained slide to an H&E image, which is generated by the computer, and also a decision support system using artificial intelligence to guide the pathologist as they navigate through these complicated cases. So the other thing which needs to happen for us to use AI successfully in pathology is we need to have integration with the patient's healthcare records, the scanning systems which scan the digital slides and make it into digital images, and send this information across into the electronic medical record and the lab information system. So this is an example of a message from an LIS into the LIS from the whole slide scanner after the scan is completed. So the pathologist can then go into their work list and they can see, for this patient, we have images available. For this patient, these three patients, I can click on a box and I can see the images. I can see what is available. We also now can press a button and quantitate the biomarker signal or an immunohistochemical signal. It could be cytoplasmic, it could be nuclear, it could be membranous. But you can see if I attempted to quantitate each cytoplasm or nucleus which was positive, I'm going to be there forever. And I'm going to be forced to give an inaccurate, subjective answer. So we can now use AI to quantitate things more easily. We can also build tools which allow us to do the things that we do on the microscope much more easily on a monitor. So this is a co-registration screen where I can register up to 6 concurrent images in the same field of view. So for example, in this skin biopsy, I can see immunostains side by side in melanoma with the H&E slide, and I can look at up to 6 images. So I can see which one of these cells are neoplastic, how far they are going into the lamina propria, and so on. What about once you have the slides digitized, you can open new doors in algorithm usage, AI usage. Identifying things becomes easier, quantifying things becomes easier, synthesizing the information with the clinical information. For example, prostate biopsy with the patient who has a high PSA, you can make that process easier and faster. So it's really opening up quantitative immunohistochemistry like never before. You can do directed review. So in this field, you can see this is a lymph node where the computer has, where you can see metastatic carcinoma, but the computer can identify example regions and find the cancer for you and quantitate the cancer if it's necessary. You can also do disease surveillance. You can also see disease progression and extent of disease in lymph nodes. So today, this is all possible with AI. And so if you're a pathologist who has 100 lymph nodes to review, wouldn't it be nice to have a tool like this, which will actually show you all the areas where the computer thinks it's cancer? So annotation, quantification, rare event detection, even for using laser capture microscopy, where you want to dissect these cancer areas from the lymph node, you don't have to do this manually and subjectively. You can use digital pathology, computation pathology with technologies which will dissect this tumor out of this lymph node automatically. So I can press a button and I can see how many 1 plus nuclei are there, how many 2 plus nuclei are there, how many 3 plus nuclei are there for this patient with breast cancer. And this is the ER biomarker immunoanalysis. So it's really, really powerful tool. AI has a potential to do things more objectively and quantitate things more easily because the image viewer can display the region of interest in which you are interested in. This is an example of a prostate cancer prostate cancer algorithm where the computer has identified the regions of cancer and it gives you a cancer probability of 100% and a 3 plus 3 grade and a score. And it also tells you what percentage of this region of interest is out of focus. So this is a really, really powerful tool. And I expect in the future, in the next year or two, we're going to see many more commercially available tools, AI tools for pathologists. Obviously, you want to make sure that you have all the ingredients to make the usage of this tool easier. And during our panel discussion today, we will discuss what are the challenges, why aren't pathologists jumping all over it? Why isn't this a tool that is being used in all the labs around the world? So you can create heat maps and you can see where the cancer is and potentially what grade of the cancer is. This is another tool by another company where they actually use immunohistochemistry as a ground truth and used it to build a tool for prostate cancer detection, where the ground, you can see on the left-hand side in blue is the ground truth, and underneath is the ground truth overlaid by an AI prostate cancer prediction model. This is just an example of breakthroughs, right? So this is a tool which allows us. So the point is, there are many AI tools now available for pathologists, and if you look at it, some of these tools are commercially available. Some of these tools are being built in research lab. But when you put this all together, AI pathology is here. It's here now today. As pathologists, we need to get more involved in all aspects of AI tool developments, research, building tools, collaborating with scientists, clinically using these tools, validating these tools, and finding the areas which work and finding the areas which do not work, educating our residents, our trainees, our colleagues about the power of this technology and the innovations that it brings to the pathology world. So this is an email that I received from one of our GI pathologists. I just want to share something exciting. The first picture is an H&E with IHC proof tumor focus that I missed. The second picture is the same area where AI picked the cancer. Thankfully, with AI help, I eventually made the correct diagnosis for this case. So here you can see the orange box, but the computer actually picked up this cancer, and it was confirmed by IHC with a keratin stain. So it's really an exciting time for us. In our lab, have been deploying AI since 2017, and now we have labs where, as the glass slides are made, they get scanned. We have pathologists who are excited about this technology, and they're starting to use AI. But with any new technology, there comes challenges and there comes barriers, right? So we have to get into this cutting edge research. We have to get into the cutting edge diagnostics, but then use these new tools like image analysis, like deep learning, like AI, integrated with our electronic medical records. But for us as pathologists, it's imperative that we continue to innovate in our field. We continue to create breakthroughs using AI for clinical care and pathologist workflow. And all this research can ultimately be translated and implemented for high quality, high value clinical care and outreach. So it can help patients, many more patients than ever before. So with this, I want to end my talk, and I will be available to answer any questions and be involved in the discussions in this town square meeting. So thank you so much for ASDIP for inviting me and to speak to you today and be part of this panel. Thank you.